Hi again. This is the video on anxiety and panic disorder. Just going to explain the differences because there are differences. They are two different diagnoses. People kind of interchange panic and anxiety attacks, but they are not the same thing. I will tell you what each is and the kind of things you'll feel if you have them. That's generally what how you can tell them apart. Anxiety disorder is a nervous disorder. Generally, it is a feeling of worry, nervousness. Maybe you're a little bit nervous about your future, or maybe if you're around a lot of people, you get nervous from being around so many people. That's social anxiety. There's different kinds of anxieties, but basically worry, nervousness, shakiness, your adrenaline starts to pump, and you'll get a lot of intense feelings, which I'll go over in a second. Panic disorder is a little bit different. It has the same general symptoms as anxiety, but it has something that's different that is what classifies it as a different disorder. Instead of being worried, you're frightened. I mean, a deep-seated fear that you can't explain. You'll get the nervousness, the shakiness, heavy breathing, things like that. But you can also get paranoid. And the biggest factor in what panic disorder is compared to anxiety disorder is the fear. Most of the time, you don't know what you're afraid of. It's just a feeling of fear. The kind of feeling you would get in a situation, say, if you're being attacked by a bear. You have that fight or flight, feeling. That's kind of what it's that part, but you don't choose. Like, you can't really fight or flight because you don't know what's going on. You don't know why you're afraid most of the time. Sometimes it'll be a fear. Sometimes it can be caused by like a phobia. If you have like a phobia of spiders, or I have lots of phobias, but I'll do a phobia video later. But that's the big difference. So if you notice you're having the symptoms that I explain in a minute, but you have fear, a really intense fear, that's panic disorder. So the other things that you'll have with both, like I said, you'll have a nervousness, you can be shaky, your vision can blur, you can get lightheaded, hyperventilating, which means taking shallow breaths and you're not getting enough oxygen, if you don't know what that means. Pain in your chest, which for someone who's young or someone who has never had an anxiety attack can feel like a heart attack. It's a little bit scary. I've been to the hospital several times because of the intense chest pain and not being able to breathe, and thinking that knowing that I'm having an anxiety attack, but thinking that the anxiety attack is going to cause my heart to explode. That's what it feels like. Your heart can feel like it's gonna explode. It's not gonna explode. And if you think like that, then you're gonna make yourself worry more. So as hard as it is when you're having an anxiety attack to try to think rationally, because it's not a rational thing. Anxiety and panic disorder are not usually caused by anything that's rational or logical. But just try to remind yourself that your body's going to be okay. So anyway, like I said, you can hyperventilate, you have shortness of breath. You can have other things. I get a lot of stomach problems from my anxiety. Even when I'm not consciously anxious, I do have anxiety that happens a lot throughout the day, even if I'm not feeling the nervousness or the tightness in your chest or whatever. and that can cause a lot of nausea and give you ulcers if you have enough stress. Oh, an ulcer is a hole in your stomach, if you know what that was. It's caused by acid buildup. So that's a lot of what anxiety is. Like I said, same kind of factors that it's caused by as depression and any other mental disorder. I think I described it well enough. I mean, there's a lot of symptoms to anxiety because it can cause a lot of things. You know, those are the main ones. If you have any questions, if you have any symptoms that you're thinking maybe might be anxiety, let me know. I will let you know if it's possibly anxiety. But if you have it, you're most likely going to have the ones I said. Alright, so this will be the end of this video. The next video, I will just share some of my experiences. And then I'll stop making videos for today because I'm losing my voice.